let's get to our big story. One of the most pressing issues facing our state probably comes really as no surprise to many of you, our viewers, Oregon's meth problem. We've reported on it a fair amount. Last year, we started talking about new meth, a cheap and extremely potent meth coming from Mexico and exacerbating the mental health and homeless crisis in Portland. We want to continue this reporting by highlighting a couple of articles that are definitely worth your time. They're from the Lund Report, an independent online source of health-related news. The two-part series explores new meth, how it's overwhelming our health providers, and how there appears to be no big plan from the state to combat this epidemic. Earlier today, I spoke with Emily Green, the managing editor of the Lund Report, about what led her to this project.
I started looking into this last year, shortly after reading an article that was pretty widely circulated by journalist Sam Quinones in The Atlantic. And in it, he explained that the meth that's been circulating around the United States for the last 15 years is different. It's synthetic, it's more potent, it's cheaper than ever before, and it's also driving people into mental illness and homelessness faster than older versions of the drug ever did. And he said it's quote unquote creating a new population of mentally ill Americans. And I thought, well, if this is true, there must be some kind of impact on Oregon's mental health system, which for years has been struggling to meet demands. So I started talking to folks who work in the behavioral health system in Oregon, counselors, providers, staff at Oregon State Hospital, people who formerly have used meth, people in the justice system. And what we found is that it's having a huge impact, not only in the mental health system, but in hospitals, jails, and within homeless communities. And it's pretty widely known among behavioral health care providers that meth has changed, the problem has changed, and we are seeing a lot more meth-induced psychosis, longer-lasting mental illness associated with meth, and it's often punctuated by homelessness, which has its own array of things that can trigger mental illness as well.
Yeah, now let's talk about treatment. Oregon State Psychiatric Hospital in Salem has made headlines for years because of overcrowding. Green says this is happening because of the sheer amount of people arrested and charged with a crime who are found unfit to proceed with prosecution. So instead, they're sent to the psychiatric hospital and treated until they're ready to go back to court.
But what we discovered is that many of these patients, their mental illness is very closely intertwined with meth use. In fact, about 70% of these patients have a history of meth use. And one forensic psychologist told me, and these are the folks who evaluate folks while they're in the jail to determine their mental fitness. He said if he evaluates someone who isn't a meth user, it's a very refreshing palate cleanser. So it's significant. And again, what we found from talking to a lot of folks is that homelessness is a major factor with a lot of these folks. And it's really important to note, though, I think that many people who use meth never become psychotic. Many people experiencing homelessness do not use meth. And there are many people who are homeless and who use meth who don't become psychotic. However, the population where these triggers do combine for that, perfect recipe of severe mental illness, that population is growing. And the court competency population itself has tripled in the last decade. And that's, of course, when this population gets tied up with the health system. And so whereas Oregon State Hospital used to take a lot of other patients who need long-term acute care, such as folks who have been civilly committed, those beds are largely occupied by this fitness for court population. So now other hospitals around the state are forced to board patients who really need the acute long-term care that's available at the state hospital.
The toll is obviously heavy on those who are addicted to meth, but it's also taking a big toll on our health system as a whole. The problem touches really every corner of the state, but it's particularly bad right here in Multnomah County, where just last year, the county saw about 7,500 meth-related ER visits.
And this is often when folks are experiencing some form of meth-induced psychosis. At its worst, it can mean acting violently and erratically and thinking that people are out to get them, including people who are actually trying to help, like hospital staff. So it can be dangerous for the patient and it can be dangerous for staff. And when you look at both the boarding issue and the emergency department issue, it's really taxing. It's driving up costs, but it's also really taxing to the hospital workforce, who often see the same people come in again and again with these issues, both at the state hospital and other hospitals. They're a little sicker each time, a little harder to treat each time, and they can start to feel really helpless because these folks aren't getting the help that they need.
We can't recommend reading this series enough. We know so many of you out there are interested in hearing much more about this, which is why we're going to air more of this interview tomorrow and let Emily Green tell you even more about her reporting. If you'd like to read her stories now, go to thelundreport.org, or you can also check out her Twitter feed. Now let's